In this episode of Quick Hits, my co host Ken and I are excited to bring you an in depth conversation with Dr. Michael Pfeffer, a true leader in healthcare innovation. Dr. Pfeffer serves as the Senior Vice President and Chief Information and Digital Officer at Stanford Healthcare, and he's also a clinical professor of medicine and Associate Dean at Stanford University School of Medicine. With such an impressive background, Dr. Pfeffer has been at the forefront of the digital transformation in healthcare, and today he shares valuable insights with us. We examine the monumental shift from paper records to electronic health records and how that transition has revolutionized the way healthcare is delivered. Dr. Pfeffer takes us through the challenges and triumphs of implementing EHR at one of the largest go-lives in healthcare history and how it set the stage for today's advancements in AI and automation. As we look ahead, Dr. Pfeffer discusses the future of healthcare IT, including the potential for artificial intelligence to alleviate clinician burnout, streamline patient care, and create truly personalized medicine through precision health. We also touch on the critical topics like data security, health equity initiatives, and how Stanford is leading the charge in these areas. This episode is packed with insights that are not only relevant to healthcare professionals, but also anyone curious about the intersection of technology and medicine. Don't forget to subscribe to the podcast and join the conversation on LinkedIn, where we'd love to hear from you.
And welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how are you?
Absolutely thrilled to be here, Ken.
Excellent. So am I. We have a great conversation today. I'd like to introduce the audience to really a person with an impressive resume. This is Dr. Pfeffer. He is the SVP and Chief Information and Digital Officer at Stanford Healthcare. He's also the Clinical Professor of Medicine and Associate Dean at Stanford University School of Medicine. Dr. Pfeffer, welcome to the show.
Thanks so much, Ken. Really appreciate being here.
Yeah, we're excited about it. And certainly we've got a lot of questions that we'd like to get into. But first, just to kind of help our audience, can you give us a brief rundown of your background and how you arrived at your current position?
Yeah, happy to. I spent my career really thinking about how can I work with amazing people to make healthcare better, and found my way into informatics a long time ago now, actually. And it's been such an incredible journey. When I was an undergraduate, I focused on chemical engineering and really loved the design principles and implementation science associated with engineering. And bringing that into medicine, probably one of the most complex areas, it has been just a tremendous amount of fun to try to solve problems that ultimately make the lives of patients and clinicians better. So that's how I kind of found my way into informatics. I still love patient care. That's why I went into medicine. So I still see patients as a hospitalist and get to work with really inspirational medical students and residents that share the same vision of wanting to make healthcare better.
That's great. And I'm always appreciative of individuals like yourself who still want to be involved with on the clinical side. And it's such a challenging role. And I'm sure you have to do a lot of balancing, but really your contributions to healthcare IT are really helping move things forward. So I guess that kind of takes us to our first question. Can you share some of the most significant innovations in healthcare IT that you've been involved in, especially in how they affected or improved patient care and outcomes?
Sure, absolutely. I mean, I think the biggest change that I've been involved with had to do with digitizing the paper world and moving into the electronic health record environment, and really, for the first time, bringing together really robust data sets and the ability to provide clinical decision support to providers in real time. And that was just such a privilege to be able to do that at UCLA when we went from paper to the electronic health record. At the time, the largest go live on a single day, which was both amazing and terrifying, but went well. And so over the years, I've really seen kind of healthcare move beyond that transition and really harness the power of multiple technologic platforms in the care of patients. And that really enabled kind of this where we are today in terms of really thinking about artificial intelligence and these new kind of really transformative technologies and how they can now support healthcare. Whereas if we were still on paper, you could imagine AI isn't going to be very helpful. So that whole, transition period from the paper world to digitization has been really incredible in many different ways. And within that are so many projects and great ideas and all of these things that have improved patient outcomes throughout that.
Well, that might be a new record for AI being brought into the conversation. Thank you. I mean, we love talking about it. But before we get to the future, if we could kind of discuss, let's go back to the past just a little bit, because you did really going from paper to electronic records is a monumental challenge. Certainly, I've been involved in a lot of data conversion. So has Tyler. What would you say were some of your biggest challenges when implementing these initiatives and going into going to a digital record?
Yeah, it's a great question. And I think even though we'll go into the past, I think it's a common thing going into the future, and that's change management.
Mm-hmm.
It's really getting people to buy in to the change because it's a massive change.
Mm-hmm.
Understanding the benefits, having a voice in how the change is going to happen, how the systems are going to be configured, and then ultimately after go live, you know, making good on your promises of optimizing and listening to feedback, always trying to make it better.
Mm-hmm.
So I think that was the major challenge. The second major challenge is all of a sudden, such a platform like the electronic health record seems to be the solution to everybody's problem. And so it was really about taking a step back and saying, no, we're not going to have 5,000 alerts to fix what everybody wants. We're going to have one. We actually went live with one alert at UCLA.
That's pretty impressive, actually.
that was quite a feat, but it allowed us to understand how it was going to work and then begin to roll out more and more alerts that really did solve a problem rather than just turn on alerts for the sake of it. Mm-hmm. So those would probably be the top two. And I think it's a good lesson going forward too, when you have the capabilities in a system, it doesn't mean you should use it. I think you really have to be strategic about it.
Absolutely. So how did you get the teams on board with that? Because that's one of the biggest things is everyone's concerned about their individual workflows. How do you get your team to sign on and be okay with, we're going to go with a minimal approach and build on from there?
It's not easy. I think, it goes back to explaining why. Like, why would we want to do that? What are the principles behind clinical decision support?
Mm-hmm.
How can they go wrong? How are we going to monitor them? And so it's better to start with the things that are most important and you can focus on them. The other thing is, being a practicing physician, I could say, well, I'm not going to answer 35 alerts.
Mm-hmm.
So kind of leveraging some of that kind of in the trenches mindset also is pretty helpful.
Absolutely.
When you think about these things. But it's not just me. I mean, there's so many people involved in these who share the similar ideas and deeply understand how we can be successful. And so it was really a collaborative approach on that.
Yeah, Dr. Pfeffer, a lot of times on this podcast, I get to go back into the past. And so I was very blessed to be at UCLA as an analyst and always admired from afar your ability to lead and also your ability to essentially, get to places that take many people many years to get to. which as we speak now, I can see how your foresight, particularly around BPAs. And luckily I was not building BPAs at UCLA Health, but in many other projects, I might've been behind, 13 to 20. Curious though, to, as you have evolved in your career, what advice, would you give to young leaders, but also maybe what advice was given to you that you took to heart, especially as you made decisions around or built consensus around, light usage of alerts and, essentially prioritizing the system above the individual into how you roll out the EHR.
Thanks, Tyler. Well, yeah, it was great to have you at UCLA, and there's nothing wrong with BPAs. I think they're very important. It's the right ones, right? You want to do it right, and such a massive transition. You want to make sure medications get to patients, not like tons of alerts are flashing in people's faces. But anyway, um, I think there's a couple things. One is finding good mentorship. And I was very lucky when I started in the physician informaticist, or they called it the physician catalyst role at UCLA, to have incredible mentors. The CIO at the time, Virginia McFerrin, just was such an inspiration and helped me really understand kind of leadership and the need for change management, the meeting before the meetings, things like that. It was just really, really helpful. And someone, of course, to bounce ideas off of, right? You really need someone to really understand that. And as well, the executive director of the program, Sarah Kramer, was really inspirational and a great mentor for me as well. Always challenged me to think outside the box, and would always give me feedback in real time, both Virginia and Sarah, which was incredibly helpful. I would say as new leaders, you want to ask for feedback all the time, and not at the end of the year for your review, but after a meeting. How did that go? And be receptive to that feedback, because once you shut feedback down or become defensive about it, then no one will give you feedback again, and that feedback is gold. It's one of the most important things as a new leader, to get and really understand, what can I do to be better? So those are just some of the things. The last one is, like, always say yes. Um, you can always figure it out later.
Right.
But if you have an opportunity to be on a committee or to be part of something, and someone asks you, say yes, because it's just such an amazing opportunity that someone would ask you to do that. And again, you can figure it out later.
Right.
People say, well, you can't say yes to everything because then you have no time. Exactly. You can't. But can you? And maybe you say yes, and you try, and you're like, what, this isn't a really good fit, but I have someone who would be a really good fit. And most of the time, people are okay with that.
Love that. We preach growth mindset as a value at HTM, and be interested to hear if there was any particular turning point or feedback that you got, and maybe your initial reaction was not to receive it, or was a little bit defensive, or maybe if there was just an experience where it really clicked with you, how that feedback was really going to impact your career and make you better.
Yeah, that's a good question. I mean, there's so many. I guess it's more watching leaders not be receptive to feedback. It's kind of like when you're a resident physician and you work with hundreds and hundreds of attendings, and you find the ones that you don't want to emulate, and that really sticks in your mind. Um, and incorporating that, and really trying to say, I don't want to do that. I want to do it differently.
Right.
So it's looking at things that work for you, and looking at things that don't work for you. And again, it's not a criticism of anybody, because everybody has their different leadership styles, but it's like combining those things. And there's so many feedback episodes that kind of over the years that helped me, as well as doing leadership courses, which I think are helpful, not so much for the like tools per se that you get out of it, but more hearing from other people, learning experience, and just teaching your brain how to think like that.
Sure.
Um, I think are really important things. But that doesn't really answer your question. But there's been so many, I can't pick one off the top of my head that was like, aha, it's more iterative. Way more iterative than like a right turn.
Sure. And I think a lot of times, we get conditioned by Hollywood to see that story that, oh, there was one day when Dr. Pfeffer had this feedback example. But in a lot of ways, your answer is very helpful, because we talk about lead by example and, following the example of others. And there's some really interesting I guess, data point in your experience of how you also were able to take the example of others that, maybe there's some things you did not want to emulate, but it's still useful because you were looking to those individuals and getting information that could help you make decisions, which then I'll use as a segue to get us back to some more technical questions. Right now, data security and utilization are critical in healthcare. So how does Stanford Healthcare balance the need for data accessibility with the imperative of maintaining patient privacy and security?
I mean, that's really foundational to everything we think about when it comes to data security, data platforms. Um, it kind of works both ways, right? You need accessible data so clinicians can take care of patients, so
Right.
faculty and researchers can develop the next cure, the next big thing in medicine. Um, so you need that accessibility, but of course you need stringent controls in place to protect that data. And so I wouldn't say we do anything really unique. We follow the standard NIST CSF frameworks, as well as the HIPAA guidelines, and really think about how do we utilize our platforms and keep the data within those platforms such that people can do the things they need to do and at the same time protect it from the environment. So that's kind of at a very high level. I mean, we can go very deep technically in terms of all the tools and technologies that are needed to do that.
Sure.
But fundamentally, I like to say, you practice good computer hygiene,
Mm-hmm.
right? Bring your computer to the dentist, but basically making sure your entire environment is focused around protecting data security, and data security best practices.
Absolutely. And I agree. I mean, we've definitely been having a lot more discussions about data security and the importance, and then also just recognizing the damage that can be done if security isn't placed really high, probably the highest on the list, right? Because that can do damage to an organization. It can do damage to individuals. Just thinking about recently in the news, there was talks of the Social Security number breach and the
Yeah,
implication that has. So from a healthcare perspective, we have to be extremely aware of the criticality of the data.
absolutely. I mean, every day there's another
Hmm.
breach, not necessarily in healthcare, but a lot of I've gotten a bunch of letters in the mail from different companies saying things have been
Hmm.
breached, and so what do you do about it? I mean, people often ask me like, well, what do you do about it? What if your social security number is in the dark web? It's a real challenge. One of the things I think could be pretty useful is going to the credit uh, bureaus and locking your uh, credit accounts,
It's true. I
so
have heard
people
that.
cannot open up accounts with your credit. If they do a credit check, it basically says it's blocked, and then you can open it up when you know that you're going to be applying for, say, a new credit card, and then close it back down again. So I'd highly recommend
Hmm.
that. A lot of the credit monitoring agencies are fine, but it may be too late if someone's able to get a credit check and then an account is open. So, there's, I think, being very proactive around those kind of things are really important. But yeah, it's pretty crazy how many breaches are occurring, data published in the dark web,
Yeah.
um, and you know it's really about piecing together data. So uh, a lone social security number is not as,
Their entire demographics record, right?
yeah, I mean, so that's really where you get concerned. So trying to find out, well, how much data accompanies the high risk data is always helpful,
Yeah.
but in the end, I think being very proactive is really important. The credit monitoring agencies are important, and then really, setting things up with the credit bureau agencies that you can protect yourself.
Well, and that goes back to what you were saying too about making sure that you give the data, you give access to the data they need, but not more so, and so we just have to uh, employ basic data security policies. But Tyler, was it Stephanie Davis that was talking about how we've gotten to the point where we basically, everyone needs to have a plan for what to do when there's a security breach versus assuming that that'll never happen?
Yeah, exactly. Great episode with Stephanie where she essentially just advocated taking out a security or taking out an insurance policy as if it's
Yeah.
inevitable, and then just have all the defensive measures ready to go instead of obsessing over the proactive
Yeah.
measures.
Not to plug our own show, but yeah, that was a really good episode. Moving on to our next question here, Dr. Pfeffer. So, when we look ahead, right, what do you see as the most promising development in healthcare IT, let's say over the next 5 to 10 years? And then specifically for Stanford Healthcare, how are you guys positioning yourself to lead in those areas? What are some of your current initiatives that you can talk about?
Hmm. It's a great question. If we go up 50,000 feet, right, the idea is that we improve patient outcomes with health IT, continue to improve patient outcomes with health IT, and reduce costs, which we haven't been as successful at. And so if you then begin to come back down to earth, all the capabilities that we now have and will have around artificial intelligence, I think really does take us from the digitization era of healthcare to the digital era of healthcare, where the systems, the platforms, the data really begin to work for the clinician and the patient in new ways. I can only imagine, you know, what it's going to look like in 5 years as we see, generative AI models just exploding in their terms of their capabilities and function.
Mhm.
So it's really, really exciting. I think we start more with automation. So, what are the tasks that our clinicians and patients are doing now that could be done by computers? So, it's not necessarily creating new capabilities, but really taking away the things that we can automate. So, for example, listening to a patient physician conversation and drafting the note. Huge win. We've got that live now with over 250 clinicians who are loving it. And we're looking at things in terms of patient messaging and the revenue cycle, and the list goes on and on. But those things are really going to provide value up front because it's giving back time to people so they can use it to better think about patient care.
Mhm.
So I think, that's where we start, and then we really move into precision medicine at scale, which is leveraging large data sets, clinical decision support in real time, specific information about patients, including genomic variants and social determinants of health, to really start to provide truly personalized medicine decisions. And that's really, really exciting. If you think about it, we have randomized controlled trials that are really fantastic on how we think about what to do in medicine. But in the end, they're averages,
Mm-hmm.
right? On average, these patients do better. And so the question is, well, how do you really get to the point where you know which patients do really well and which patients don't, and choose a different therapy or treatment plan to much more focus on individual patient decisions?
Yeah, I think, well, I've been reading a fair amount of Hemingway recently. So when you're talking about cutting, it's almost like we're in this era right now where we're cutting, and you're cutting out tasks in order to free up the provider. And that sounds to me, Dr. Pfeffer, like where we're at. So we'll call it like the Hemingway era. And then the next era seems like that true science fiction era. Like we're actually going to be doing different, or the work truly changes.
Mm-hmm.
So I know we put in some timestamps here. How do you, if you will, do you have any way you think about the timeline we're at, and when we start seeing that personalized approach, and how long we stay in this current stage where we're just trimming the duties that maybe were a product of the digitization?
Yeah, it's a great question. I think that we're going to start to see these augmented approaches where, the clinician plus AI can do things that neither can do alone, start to really ramp up over the next few years. We have to make sure that these function safely, ethically, they're monitored, so that they continue to provide the right support and right decisions, basically. I think we'll see a lot more automation happen during that time period. So if you think about two curves, you can think about the automation curve with a very steep slope, and the augmentation curve with a much kind of lower slope, but then will start to really increase over time. The other thing that's really interesting is the automation tasks are going to get us better little data. And everybody talks about big data, but big data is a bunch of little data. The little data isn't good, and the
Mm.
big data is really not good, right? But if we're recording and transcribing the actual conversation that happens between a patient and a physician, and we're incorporating better data around genomics and social determinants of health, just imagine how good the big data is going to be.
Right.
And that is going to change things. I mean, there's lots of observational studies. One that said we should all take aspirin, and then that's debunked.
Hmm.
So observational, studies are based on, large data sets and following people over time. But you can imagine that as the little data becomes better and better and better, we'll be able to make even better predictions from the big data sets. And I think
Hmm.
that's going to really be able to drive precision medicine at scale in new ways.
So you mentioned social determinants of health. What kind of work is Stanford Healthcare doing when it comes to health equity? What are some of your initiatives in that area?
Yeah, it's a great question. So, a lot of the work around health equity is making sure you have the right
Mm,
data. Because if you can't measure kind of the impact you're having, then it's hard to know. So, you know, really making sure we gather the right data. And that's an initiative here called We Ask Because We Care. It's a huge partnership with many, many groups, including our patient experience group, to really make sure we gather the appropriate data around gender identity, social determinants of health, race, ethnicity, to be able to really measure what we're doing in this space. And then everything we do has a lens of health
mhm.
equity to make sure the things that we're implementing, whether they're in our patient portal or throughout our systems, really have that focus and mindset, such that we make sure that what we're doing includes health equity. So it's really impressive. In addition, we have new leadership as well in health equity. in our health system, which is really exciting to really put that focus. And I think a lot of additional work that we have planned in our patient portal, leveraging generative AI to really bring the information in the portal to patients in new interactive ways.
Generative AI was a big topic of discussion at UGM, Epic's user group meeting last week. Dr. Pfeffer, any other news or takeaways that came through from Madison last week that excited you?
Yeah, I'm really excited about the integration of the Cosmos data into the electronic health record, and really leveraging that massive longitudinal patient data set to better understand how to make decisions on the patient sitting in front of you in real time. And I think they highlighted that a couple times, and that was really interesting, as well as connecting physicians with complicated or rare presentations such that better decision making can happen uh, outside of the walls of, say, the clinic or facility that you're in. That's really exciting. So, in addition, leveraging that data set to make discoveries, I think is really exciting as well. So those were some big take homes for me. And of course, they listed over 100, future and current uses of AI that they'll be rolling out. So this is really, being embedded across the board in not only their platform, Epic's platform, but many of the different solutions that we're using. So it's really, really exciting, all the capabilities that we're going to be seeing in the future.
Have you had that moment yet where you realize that maybe AI isn't as far along as we think it is, or would hope that it is? Like, has there been kind of a level set for you?
Oh, for sure. I mean, there's always a lot of hype with a new
Mm-hmm.
technology. I mean, if you remember a few years ago, all of healthcare was going to be on a blockchain. And
I may have said that
didn't,
several times.
yeah, didn't quite turn out
Right.
that way. And, I think certainly the technology has a long way to go in
Mm-hmm.
healthcare. It cannot replace and will not replace physicians, um, and or nurses or physical therapists. I mean, the list goes on and on, right? I have yet to see generative AI put an IV in a patient,
Right.
right?
Right.
So I think we just need to set those expectations very, very clear. It's really about how do we use it to help people do their
Mm-hmm.
jobs better, to help take better care of patients. I think what's really critical is making sure we measure
Mm-hmm.
outcomes, not just process, but real outcomes. I'll give you an example. We studied generating draft in basket messages for our providers. So a patient submits a message through the portal. The system generates a draft response. That draft response is a starter point. It's a place for the clinician to start and edit it and then send it. You have to edit it. So it's kind of this human in the loop idea. And we measured how much time is saved in the in basket, right? We were sure that we were going to save time. Turns out we saved no time. It was equal.
Wow.
So process measure failed. Now we could have just stopped there and said, this is useless. Let's just turn it off.
Right.
But we also have an amazing partnership with our WellMD team led by Tate Shanafeld. And we have a very robust measure of burden and burnout outcomes, right? Those are outcome
Mm-hmm.
measures. Turns out we reduced burden and burnout by reducing cognitive load. So even though we didn't save any time, a process measure, the outcome measure of burnout improved. And so I think we just have to be thoughtful as we roll out AI because it's not free, right? I mean, there's costs to it just from compute and storage. There's environmental costs, right? It requires more power. Um, and, I'm sure there's lots of other things that we need to take account of. So we better make sure that it's actually improving outcomes, right? And that's what I think we need to focus on. And that's hard to do. That discipline is really hard to do.
That's a great thought, is calculating the entire cost, because I think you're right. So many industries are just looking, how can they just replace people with AI, and then finding out that it's not necessarily something that can easily be done. And especially in the medical field, in the clinical world, you don't want to replace doctors, and you don't want to replace
Yeah.
Clinicians who who've been in the
Right.
trenches and who really understand patients. And AI doesn't understand the impact of social determinants of health quite yet. We're getting there, but yeah, that you bring out some really good points on the true cost of replacing aspects of healthcare with that.
Yeah, I mean, if you think about it, like, I'll be very provocative here. Like, AI will not replace anybody in healthcare. We already have significant healthcare staffing shortages
Mm-hmm.
in the
Mm-hmm.
world, let alone in the United States, right? So, in my mind, we have no choice but to leverage AI to help our current healthcare providers to be able to see more patients and deliver more care. It's not a, if, it's kind of an imperative, right? That's why we have to get it right. But it is not going to replace healthcare providers.
It's so good to hear the change in tone. I mean, not that your tone was around this, but Dr. Pfeffer, I feel like, I remember Vinod Khosla speaking about, putting blame on providers for deaths around, reads. And I would guess or hope his tone has changed, but it seemed like in the 2017-ish era, that AI was, interpreted by many industries coming for their jobs, but particularly coming for the clinicians' jobs. And no surprise that there wasn't much embrace. And also, this was the pre GPT era. But it sounds like from our conversation today, now I'm able to think of it in terms of automation phase and augmentation phase. And augmentation totally implies that the current staffing doesn't change. It's just the cognitive load decreases for these more mundane tasks, and then we can ideally get more out of each individual provider, and allow them to get more out of their practice.
Mm-hmm. Yeah, I mean, medicine's, I would even say, more an art than a science, right? And that art is just so important, and really is why clinicians do what they do. I mean, it's more than just prescribing a medicine, right? There's so much change management, if you think about it, in every single interaction that a clinician has with a patient. Change management has to happen. There needs to be an understanding. There needs to be uh, an opportunity to voice concerns, ask questions, be part of the process, be engaged. All of these things, that's change management. And the more that can happen, because AI can offload tasks that could be automated, the better we're going to do. So I'm just really excited about that.
And speaking of arts, I have heard that you're a music fan. Feel free to take this question wherever you will, but Rolling Stones or the Beatles?
I gotta go Beatles.
Nice.
The Beatles are just, I mean, they're both amazing, amazing bands, but the Beatles just so transformative, and their portfolio is so diverse.
Mm-hmm.
It's just really, it's really remarkable.
When it comes to the future, right? So we've talked about the future for technology, but also the next generation of leaders and healthcare professionals who are in this new environment that is growing. I think, can you kind of give some advice to these young leaders, and maybe what's your role in educating the next generation to really get the most out of digital health?
So, Ken, that's a big question. I will do my best. Um, Let me just say this. I think it's a real privilege to be able to work in healthcare. And starting with that, right? Two things. One is surround yourself with really smart, dedicated people, because this is a team sport. It is nothing that I've done in my career hasn't been without an amazing team, and I would even argue they do way more of the work. So it's building teams and relationships within those teams is absolutely critical. And the second thing is have fun. This is fun stuff. I mean, you can see the ideas that teams have translated into patient care. It's remarkable. So those would be my two pieces of advice for up and coming leaders. If you have fun doing what you do, other people will have fun and they'll want to be part of that. And I think that's just so important. Not every day is going to be fun. I get that. But overall, it's just such a great field. So enjoy it and have fun.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.